differentiate our products with other products in the market. Okay, by rights, refer to the Ministry of Health of Malaysia, KKM, the Medical Device Authority, MDA. Okay, by giving a definition at here, it's shown that, okay, the medical device means any instruments, apparatus, implemented machine, applicants, or implants, in vitro, reagent, or calibrators, software, material, or any other similar or related articles which is intended by the manufacturer to be used along or in combination of human beings for one or more the specific purpose. Number one, diagnosis, prevention, monitoring, treatment, okay, elevation of diseases, and so on and so forth. You can read, okay, by yourself. But what here is trying to say, okay, any medical device by the definition have to be used along and the combination with the claim of the functions of diagnosis, prevention, monitoring, treatments, or elevation of diseases. So that's why if today we are selling something in the category by definition given by the authority, okay, to show people like, okay, these things is able to help in certain way, which is in vitro, means it's not orally or injections, okay, by then it has to be classified as a medical device. Okay, later on, okay, if you have any questions, you can ask me after my sharing during the Q&A sections. So followed by that, why is so important to certify as a medical device? Because once these products, as I mentioned, who claim with such functions, okay, which may generate, okay, certain level of the risk, okay, that's why the authority of the world or local authority of Ministry of Health has already classified the risk into 4 categories, from low to the high, which in Malaysia they categorize as class A, B, C, and D. Okay, the rating is based on the risk level of the function with the technology as it claimed. Okay, why do so? Because the authority have to play a significant role, to guard, to protect our public health and interest. That's the main idea. Put in the layman way, like if we are claiming something is very functional, okay, towards to our health, okay, but the government have to make sure with such claim or the efficacy, it has to be safe to use. That's the prerequisite. This most important is to be safe. That's why the government setting a law rules, okay, to classify the risk, and then each of the products, if you wanted to apply or have follow such rules, okay, that's why it's important, because they have to manage the risk. So what is the differences between medical and non-medical products? By giving example here using IM laser and other laser products. Okay, I just simply show few of the key points, I think, which is easier for us to understand. Number one is the cost. Okay, like other products in the market, to have something like IM laser with the cold laser, integrative cold laser therapy, the cost can be low as even lower than 100,000 ringgit Malaya. Okay, the period of development can be done within 3 months. And the wavelength we're talking about, I think most of our leaders understand what is a wavelength. I mean, the energy, the wavelength, stability is 7.5 nanometers, which is much higher than what has been requested under the law stated in the guidance in the Ministry of Health for cold laser. Okay, the strength of accuracy, which is exceeding or lower than 5 mW, even more than 20%. Of course, the security is increasing the number of lives, resources. I will be breaking the truth. So compared with the Vantros IM laser, okay, we are develop such products, okay, closely with the guidance being provided by the authorities, which is very important to control the wavelength and the total strength of accuracies, okay? So based on the cost so far, including the registrations, okay, it takes us more than 2 million, okay? And then the development period for the products is as long as 16 months. The total registration takes 4 to 5 years. Until today, we have a full licensing to distribute such wonderful products as the first cold laser therapy in Malaysia. And with such wavelength, okay, well, stability as 2.5 plus minus 2.5 nanometers. Okay, so we had to strictly comply with the intensity throughout the obtained in the clinical trials. So that is the difference. How shall I to show you? Okay, take a guess here. Okay, we take a short guess here. How many steps is a question I'm asking you. How many steps do you think to be in the chat box? How many steps? Okay. In order to develop a medical device, okay, and then the manufacturing, can you hear me?
Can everyone hear us? Sorry, just. Can anyone just type 1 if you can hear us? Hello? Okay, it's okay. Just to double confirm because we heard someone saying that there is no sound.
So everyone can hear, right? Okay.
Everyone can hear clearly, Thank you so much,
Okay. So basically, I think most of us, some of our members and the leaders understand, but here I think it's good to know that, okay, to certify as a medical device, okay, we need starting from the component from the suppliers, and then through our manufacturing facility also need to be certified. After products to be produced, okay, we also have to do a product certifications under medical device. And then to distribute the medical device, we also need another special license as a distribution channel for certifications. Until it come into local market, you need to re-register the product again to grant the local product certifications. So the development of a medical device IM laser, the entire duration from the development until the final granting the assessment to sell in the local market, it takes us 4 to 5 years until today. Okay, the total cost is up to 2 to 3 million ringgit. Let us go through one by one, okay, how these certifications looks like and how are these certifications to be recognized, and how is the flow, how is the process of the flow chart, and we understand behind of this why the authority has applying such strengthened law, okay, to on the medical device registrations. Okay, so first of all, we look at what is the manufacturing license like in China, okay, under the National Medical Product Administrations. Okay, our factory Zhang has already granted a manufacturing license. That's how it looks like. Okay, and part of the medical the NMPA, okay, approval, Zhang also need to granted the manufacturing assessment license as 13485. I think that is the license we are very familiar among our members, 13485. Okay, this is called, this is manufacturing process. Okay, this is the its assessment, okay, to manufacturing, okay, for medical device. It's under the ISO 13485. Okay, and after we have ISO 13485, only we are able to apply and get approved for the CE marking. A CE marking is a world recognized authority and assured all the products before you enter into the Europe country. You need to have these certificates. So which means by having this certificate, our IM laser is free to sell any country inside Europe. Okay. This certificate is has been certified with our alliances authority called MediCert. Okay. After the medical device, okay, manufacturing license, now we look at the CE marking, okay, as the step 2. Remember I mentioned just now? Okay, the step 2, after manufacturing facility, we are looking at the product certificate. The product certificate here, okay, we're talking about CE marking. Why I want to emphasize on the CE marking? Okay, because the CE marking, the CE certificate, has changing the regulatory by year 2019 till 2020, which is last year. Okay, so how does it change? It has been changing from the medical device directive to medical device regulatory. Maybe most of our friends and the members doesn't have a clue what does that mean. Okay, by giving example, last time for IM laser or other laser products or other medical device products, okay, in Europe, the rules and regulation called medical device directive, which means it's a directive, it's the direction. It's like a guidance to us to follow. Okay, there's no compulsory for chasing and tracing, and there's no other stringent compliance with the product registrations. But by year 2020, 1990 onwards until 2020, it has been changing the law from the directive, which is a guidance, become a regulatory. Now, all the CE marking is under the new law and the medical device regulatory system. Okay, let me to explain to you the differences of changing from MDD to MDR. Basically, there are 13 key changes. There are 13 key changes. But you'll be surprised after the increasing, which means they have been increasing from the directive to a higher level as a regulatory for medical device. So after the change, the increasing of the laws, and there you see, they're only until by 2021, February 16th, which this year, there are only 17% of manufacturer whole world I'm talking about, felt fully prepared for MDR, which is under the new rules. Only 15% reported being not at all prepared. It means 15% of the medical device of whole world has not been prepared for the changes, which law has already changed, have implied, okay? And 65% of them, which under the intending to use the full period of MDD to changing the MDR, okay? And this information is from FDA group of informations, refer to them, okay? So I give another example. To under the last time, before the 2020, to register a CE marking for medical device, taking average 8 to 9 months. But today, okay, if you want to have a CE marking for medical device under the new regulation of MDR, it takes you 1.5 years to 2 years or more, okay? The working load is 3 times more than before. Last time, for all the submissions, we are only using about 200 over pages, including all the papers. But you'll be surprised, today, for our submission of under the new MDR, the medical device regulatory, is going to 785 pages to 1,000 pages. Okay, that's the difference. Okay, and for over IM laser, you take a guess. We are under MDD or MDR? Well, the answer is very clear. Fortunately, we get over IM laser approved under MDR, medical device regulatories, and for the period of 5 years, which means that today, okay, there are only 17% medical device applying under the new rules of CE marking, and we are one of it. Then there's another question. 17% of all the medical device. But if we're looking at the cold laser therapy, the cold laser medical device, ask yourself, how many of them has already updated and re-registered under the new rules? I will rest assure you, cold laser or IM laser is one of the only in Malaysia and Southeast Asia so far, okay, under the new rules of CE marking. So very soon you will see, you can go and ask other brands to look at their certificates, okay, whether when is their renewal, and see whether have they renewed up to date. I believe there's a lot of companies, as what the report has been stated. More than 65% of companies has been struggle, to get a even renew on their certificate under the new law. So that's giving us the time advantages for IM laser in local market and in the regional market, because we are ready with the new rules and regulations, okay, of the law given by the CE. Okay. After the product CE marking, okay, you can imagine the flow. After the manufacturing have the product developed, okay, certified under CE. Then we're talking about what? How to distribute it, okay? When you distribute a medical device, you need another license. Okay, I think most of us here until here are getting struggle. Why so many licenses? Later I will explain to you the reasons. To distribute a medical device, okay, and the market the medical device, you also entitled for establishment licensing for medical device. Okay, here is the graph. Okay, by giving a definition, establishment license for medical device is an establishment can be either be a manufacturer or authorized representatives or foreign manufacturers and exporters or distributors of medical device. The completion of definition of term of establishments is given in the section 2 and I 737, OEM or tending agent not defined as establishments. Okay, so this is the flow chart to show, only to show are you qualified to be registered as an establishment license? Not yet finished, huh? Okay, this is the flow. It's a processing flow chart for submitting the establishment license of application. Okay, only this is taking Vantros almost 2 years to complete and to qualify as to distribute a medical device. Okay, so you see, it's not something is so easy to achieve. After as a qualified distributor of medical device, okay, then Vantros moving into a local medical device licensing approval, okay, under the KKM MDA department. This is the flow to show you, okay, the entire process of the local medical device licensing registration process. Pre-market, placement on market, and post-market. Okay, so MDA monitor the compliance to requirement and take appropriate action in accordance with the provision of the law to ensure each medical device, okay, has been properly documented and registered under the authority of the law, okay, to ensure the safety and the quality of the product as what it claims, okay, at what it claims. So what if people selling a medical device or people selling a product claimed with the functions? So what is a penalty? Let me to illustrate a cases in China. Okay, the penalty of illegal distribute or market medical device in China by 2013, there's been under the NMPA, the National Medical Product Administrative in China. There are a few cases. Okay, there's one of the cases by 2019 April 15. There's a company in Guangzhou. Okay, distribute something like us, the device, medical device like us, okay, with the total revenue of 4.28 million yuan. You know how much is the fine? The fine go up 81 million for wrongly distribute a medical device is not properly registered or overclaimed. That's in China. Okay, well, coming to Malaysia, because Malaysia is a smaller country than China, it's less population, but the medical device authority under the KKM Malaysia Ministry of Health has been stated clearly, okay, under the Parliament Medical Device Act regulations. Okay, look at the last line. The failure to do so is criminal offense with the convention attracts a fine not exceeding to 200,000 ringgit or imprisonment of a term not exceeding for 2 years. Okay, which means in Malaysia, if you are selling a product, medical device, without the proper licensing, like establishment license or medical device license, okay, or you're selling a product with such claim, with something like a laser therapy or whatever, but without any licenses, if the enforcement can come to catch you with this amount of the fine or prisoning, it depends the level of the law you breached. Okay, so when it come to here, why it's not trying to confuse you how complicated to get a medical device, but for the reason is that I hope you understand, any medical device which you claim is the function itself carry the risk. So the authority, in order to manage the risk and protect the interest of the public, okay, by setting the law of act, which to registration and the medical device, because once you claim the function, you have to make sure it's very safe to use. Okay, so the level of the control is been tracing from the beginning, the component, to the manufacturer, to the distributor, and to the local registrations. At each level of this point, to rest assured that okay, the product has been distributed under the law. The interest has been of the public can be protected. The risk has been managed well. Okay, so today as Vantros, okay, the meaning of IM laser medical device qualification. Okay, here I put into 5 points called SPTAT. Number one, okay, we understand as a Vantros, we understand the value of this technology. So in order to pursue and to presenting to the market, that we have to make sure the product and the efficacy is safe and very effective. Okay, so number one is safety and efficacy. Besides of that, the professional endorsement, as what I has been showing, the full licensing, the endorsement of the profession by the professionals to ensure the safety and efficacy is right in the place. And to develop under this endorsement, under this professional recognition system, we are able to develop a tracing and chasing system that to make sure every unit we sell to the market, to individual customer, that we're able to trace back until the manufacturing, until the component where it is manufactured, to rest assured that the product you are having it is safe and effective towards to what it has claimed as the function itself. Okay, and under this system, it also helps us to develop the after-sale services that we are able to know, okay, which part of the product is went wrong, and quickly we can arrange a product recall. Okay, if without this system, how you are able to protect the minority interest as an individual consumer by purchase the product of medical device? And at the last, not least, the most important here, we're building the trust between the customer and our company, building the trust between the customer and our leaders. We are, as individual leader of our company, as all the diamonds, the emeralds, the rubies, all of you who has been taking our business as your career, okay, you can be very proud and confidently to share a product to each individual family and person by showing them this is well documented, it's well checked by the authority to provide the safety and efficacy as it claims. Okay, which with this meaning, it comes back to our value of our company as Vantros. We are standing on the value and the tradition to success, not only the value to providing a quality, safety, trustworthy product, but on the traditions. We are a community, okay, among the community that we're building, friends and families, we are taking care of each of you. That brought us the prosperity and the success as the main value of our company as Vantros. I hope after today's sharing, thank you so much for this. I hope after the sharing just now, I'm good enough to walk through with you the process, okay, the entire process of the medical device registration process, and make each of members of us to understand, okay, to having a IM laser, a product has been registered, a full licensing being registered through all this authority to give you and each individual of the user the confidence and the safety for enjoying this efficacy of the IM laser. Okay, I think this is very important. So, and they give you the confidence to outstanding other similar products in the market. Okay, because so far we are the one and the only medical device of cold laser therapy in Malaysia. Okay, in Malaysia. So, and to be proud of that, our CE status under the new regulatories, which is less than 20% of the world today, are under the inspection and assessment with the new law. And our IM laser is one of it. Okay, so here is my sharing. Thank you very much.
Okay, thank you, John. This is just a simple, short sharing just to highlight your the strength of our IM laser, the uniqueness of our IM laser is actually based on the certification and everything that we have done from the beginning until the end. It is all properly done, properly registered, properly tested, as well as properly clinical trials has been done to ensure the efficacy of these products. Okay, it is more all on the technical terms and things on this IM laser today. But of course, if you do have any questions you would like to ask, feel free to ask now. It is open for Q&A now. Okay, any questions? If you want to ask, you can always put up your hands or even put out your hands. I can unmute you, or if you don't feel comfortable in talking to us directly, you can always type in the chat and we will try our best to answer your questions. Okay, a simple talk, but can highly emphasize the greatness of this IM laser, okay, through all the proper testing as well as registration done and everything, to ensure the safety as well as the quality of this product. Okay, so any Q&A now, any questions that you would like to ask on in terms of the technical things like the certification and everything? John is here to answer your questions, or it is a or even if you do have any questions on the usage part of the IM laser, or you are always welcome to ask the question as well. Okay, now is the time. Any questions that you would like to ask? Okay, ladies and gentlemen, any questions? Or you want to put out your hand, or either all of you already know the products very well, have full confidence in the product?
Yeah.
I'm sure next time if your downline asks you what's the difference between our IM laser and those selling online in China, what's the difference? I'm sure you can give the very good answer for them. Okay, any questions or anything? If no, then we will finish off this talk today. As I mentioned just now, it is very difficult for us to get John with us to share with you on the technical side or registration side of this IM laser. Now, if you do have any questions, this is the best time to ask him, yeah, to clarify with him.
Oh, no question, huh?
Okay, if there is no questions, nobody would like to ask any question, then I think we will finish off the meetings here today. Okay. Thank you so much, ladies and gentlemen, for your participation. And of course, just a gentle reminder to all of you on this Friday night. Again, John will be giving a presentation on CV8. It is in Mandarin. The time is 8:30 this Friday night. Okay, this Friday night. So again, invite your friends if you want to know more about this CV8. John will be able to tell you more about this CV8. Okay, so don't miss this opportunity. Meanwhile, before we finish off the meetings here, okay, you